Nice to meet you, and thank you for inviting me to talk to you.
Yeah, Yuli, it's a pleasure. I definitely want just drafting off of what we were just just talking about here a little off recording, but um I'm definitely it's a it's a really beautiful treasure to think about what you think about or talk to you about what I know you think about, at least from my perspective. As I was kind of thinking and saying, I really love the oral facial myology lens that you bring, but I feel like you bring so much more, massage and the somatics, the neuro-linguistic programming. But I know that even if you didn't have those, the myofunctional therapist, you all are so set up and poised to be this bridge, not just in the physical and connecting modalities and therapies, but I feel like mindsets are such an important, a medium through which we can connect, collaborate, and understand each other. And so, kind of I was alluding to how in my city, I'm very much this bridge and liaison or ambassador or translator between therapists, providers, and I love to be that. But and I actually feel, I was telling my wife Dawn this, and so many people, my patients, providers who I work with, I'm like, we are at the dawn, this event horizon in history and time in which I love what that in this field, airway-centered field. And I've created this integrative airway and feeding chiropractic field. I also,
Amazing.
call myself an integrative stomatognathologist because that's all about the connections here. And I
Yeah.
love that. But what I want to do is give the shout out to you as a myofunctional therapist. And I know you are not just a therapist, but you also lead in this in the UK. But no other field has been created out of this need for orofacial myology, for understanding the maxilla and its relationship with the palatine bone and the airway, to understand how that affects functionality in our lives replete. So I feel like that's why you're all this beautiful fields and um poised to help people in a way that I don't think anybody else can help them. Whether we're a dentist, orthodontist, ENT, SLP, IBCLC, body worker, all these things, cranial osteopath, all these. The oral facial myology field, you all were designed, created from the need of what's going on right now, and it's an awareness of what's been migrating in terms of the narrowness of our faces and our airways for many, decades at least. But no other field was created out of that, and that's where you are. I'm like, ooh, this is great. I was joking with somebody else, Renata, from Airway Circle, the other day. I'm like, oh my gosh, I want to just be a myofunctional therapist, and then I realized, no, just do what you're doing, but still, the awareness of what you do is for me such a great privilege to talk to you because I like the systems thinking, and the multifaceted way that you go about, thinking from just even the bits and pieces I've heard from you and seen. So that's why I'm excited to just meet you and talk to you and talk about what you got going on. Because I feel like, of course, collaboration is this buzz that we can have, this buzzword, this thing. But I feel like intra collaboration is what you carry well. You collaborate well with yourself in order to create something that other people can collaborate with. So I will say I'd love to just kind of just start and hear more your thoughts on these things too.
Yeah. I think one thing I want to pick up on from what you just said is that being that liaison between the clinicians and the patients and, the different provisions of services that we give to our patients. One of the things that I have become to realize with what I am offering to my patients is that what we're giving them is more than health, more than systemic health, and is mental health, is well-being, is almost a spiritual and
Mm,
grounding. It's that connection between who you are and what your systems are doing, and Earth itself. I know it sounds a little bit like
hmm
too starry night, but you're relating the body and you're relating the biomechanics of the body, with Earth itself, with gravity, with how we are supposed to be on this moving Earth. And I think it is attractive to patients, because I don't think many healthcare professionals are doing that. Not just the holistic buzzword has been around for a little while now, but one thing is being holistic and looking at the body from head to toe, and another thing is taking that body and then relating it to the world, to Earth, and how, you know, gravity holds us, and how physics and the laws of motion and, you know, gravity and biomechanics actually have a bigger role to play on our health. I don't think many clinicians are doing that. So when I give my explanations to my patients, I try and put them into, this is the world, and we're just going to concentrate on you. This is Earth, and there is gravity, and there are laws of motions. And I don't have to prove that to you, because those are never going to change. No one has to prove those to you. They've been there, you know, since the beginning. So they get it. Patients get it. It's trying to get around talking to other clinicians about it when they're setting, using the body like compartments and looking at the body in different compartments. And that's the tricky bit. But I think if we stick to the fact that we are governed by the laws of motion and gravity, and that the structure changes because, you know, the function is not correct, and we need to still compensate for the fact that we're upright against gravity, that begins to click something in people's minds, whether they're clinicians, conventionally trained, or whether they're the ordinary people with no background education. They'll understand, you know, that you have a pole with a big heavy head on top, and that we need to somehow stay upright and balance all that weight, which then leads me to explain to them about the importance of that big organ that is the tongue, and its entire weight sitting anteriorly of the head, and why it should be up. And it makes sense to them. And, you know, with that goes the spine, and how it should be, you know, straight, rather than with so many compensations, kinking that pipe into different areas that causes so much stress in the systems. And patients look at it. So being that liaison with that information, passing it on in a simple language to them, it makes it puts us in a very special position. And I think that's why what we do works. And then when you begin to tell that story often enough, your brain begins to think, what can I do to help these people do something at home by themselves, and measure things and look at those measurements and actually track the changes themselves. And that's how my tool came about. Just trying to simplify things and making people understand that sometimes a little bit is better than nothing. And we're not operating, we're not removing body parts. We are, you know, beginning with little, small, just awareness of breath, awareness of body postures, awareness of oral postures. And then if we get stuck, we can then get more help. But to begin with, let's just be aware of those things.
Yeah, I love that. I want to go back to what you ended with, but then start with what you started with, and just talk about how you were talking about our relationship with our earth. And I feel like, you know, we could say, is that woo? And it's like, or it's just life. And I think it's the art of living. And often we look at our education system and, you know, of course, all these things, many of us like you and me, and we've had to learn beyond our professions. We have had to learn more. Although I think myofunctional therapists have so much within your training, but you all are some of the most avid learners that I know, voraciously acquiring more knowledge, synthesizing more so that you can provide more. So But I think the way that we look at Earth, I'd say I see that the gravity that pulls us. And yet I say to my patients too, I say, that gravity that feels like it's working against you can work with you if you can
Mm-hmm.
optimize your alignment within that. So of course,
Yeah.
I think back to Alexander technique. I think to Rolfing and
Yeah.
structural integration. I think to bioenergetics, all the things that I kind of involve in what I do. But I often, just to kind of give homage and credit to your point, I look at people standing and supine, prone with babies as well when they're tummy time, and how the diaphragms align when they're in tummy time and the hyoid bone versus when they're on their backs. And then I look at patients' side posture, and often I'll say, ooh, in every posture or position except for lying on your left side, your kidney on the right is aligned. But when you lie on the
Mm-hmm.
left side, the kidney's out of alignment. So I need to untether that and release that in this side lying position, because you could be fine until you lie on that left side, and then kidney goes out of alignment, and I'll pull on the floor of your mouth through that fascial connection. So I'm often, just talking to people about gravity, and
Yeah.
but yeah, I often, like, I'm just like, sometimes when you feel like that day is heavy and everything feels heavy, it's like, sure, it might be the concrete and you might be wanting to ground. And I love negative ions. I love earthing. Boy, you can't have enough of that. And then I'm also like, it might be the toxins in those sandals or
Yeah.
those shoes that are making you feel
Yeah.
heavy. But then again, if you've got that, glossopostural anterior head carriage, and your tongue is anterior and stuck, and then therefore your shoulders are rounded and your whole anteroflexed body is plummeting. I'm exaggerating, but it's so forward leaning.
Forward
When
leaning.
you
Yeah.
walk around, that bowling ball of a head wants to fall down to the ground because your body can't
Yeah.
hold it until you can improve that vertical axis and get the body work, the breath work. So here's what I'll say. All of that is fine and good, but my patients are like, oh my gosh, I need you to release my cranials, my fascia, my muscles, my emotions, my structure, my this, my that, my toxins, my EMF. And I'm like, no, let me show you a little bit of what you can do at home every day
Yeah.
to help, because I want you to go to the myofunctional therapist. I want you to go to me. I want you to, but you're a mom of 3 kids, or you're a
Yes.
dad of a job, that and kids. And if you can just do this 1 to 2 minute thing at home, you can have improvement. And if you can do that over time, you can start to see the relief. And yes, you need help. But but
Mhm.
when you can't have us, you need to be able to sustain your own alignment. So I teach people this, and I really love this because I feel I need this in my life too, because I can't rely on everybody else for
Oh,
my
exactly.
we're built and designed to have our own system to tap in and listen. But I think what you said is a big thing. I think that a lot of people abdicate their own sense of agency to others because they're not necessarily wanting to look inward and listen to themselves, or they doubt themselves. But maybe that's because another provider has gaslit them. Maybe that's because they have a history of that. But I think what you're like providing is a great opportunity for people to take this agency into their own hands and to say, how can you have something on hand in-house that can like really give them a way of listening, tuning in, observing. I mean, I just want to know more about what your tool actually is, because I saw a post on it and I was fascinated. I'm like, oh my. I was like, I see a lot of tools and I use some of them, and I think they're great ones out there. We have some of these great tools. But when I saw your post, I looked at it and I'm like, the words are really good, but with the energy that comes off of these words and what this person I think understands is really surpassing. And so I was last thing I'll say before I, pass the mic back to you is that I often think in terms of the way Thomas Edison invented many things is that
Hmm.
he was a kaleidoscopic thinker, meaning he usually had about 5 to 7 inventions going at one time, because he said, "Ooh, whenever I get stuck with one, I'll go to the next, and when I get to that fourth or fifth one, then I'll realize a concept from that applies to the other one, and then he figures
That's
out how to."
exactly what I'm doing at the moment.
And I know that's what you're doing. I know you're a kaleidoscopic thinker, and I know you're an innovator. And so when I see kaleidoscopic creators and thinking, which is not common, I'm like, first of all, I'd love to know more of the way your mind works. And of course, in this airway field of what we see and the people we love to help, and from the children to the adults and babies to on up. Um, It's like, ooh, this tool feels like it has all that power packed within it, and also these understanding is so robust there. So I'm interested to know more about that, both your mind and the tool, because I feel like the tool is an extension of your mind.
Oh, thank you. Thank you. That's so kind. And no one has described that the way you've done it.
Mm.
So I thank you for that. It really is trying to pair up what I am seeing clinically and my fascination for physics and the world. I love
Mm.
physics. And what the patients are experiencing, and just giving that to them back into their hands, like you've just said, sorry.
Sure.
Just trying to make them understand that we are so powerful as human beings. We have the power within us, which sometimes just needs a little bit of guidance. That we can't use our clinicians as crutches. We need to let go of that and take, our own initiative. So what I say to them is, I'm going to give you the tools and teach you how to use those tools so you can then become your own practitioner.
Yeah.
And then if anything falls apart, because we're not perfect, we fall and we get up again. And in the process of falling and getting up again, we'll learn some things and we'll forget some things. So just like I said to them, just like joining a gym, you join a very expensive gym and you have a personal trainer maybe to help you with this, but you don't want to have someone always there with you doing this thing.
Yeah.
You want to eventually let go of that. And you want to eventually know that my biceps work this way better. They're not the same biceps as the next door person. They're my biceps. So I say to them, what this tool is going to do for you is just going to give you an extension of your fingers, an extension of your arm, an extension of what you can get to inside your mouth, and without that amount of pressure that maybe you can hurt yourself. Because the way the tool is designed, the ends are a little bit flexing. So it took me a long time to get that Newton pressure to be the right, without allowing for the tissue to be bruised. And then the measurements are really key for me, because I like to measure improvements. And I think even if the patient is not a researcher or a clinician, I think deep inside within us, we want to measure an improvement somehow, whether it's with photos or, I take a lot of photos, a lot of videos. I'm data collector. I'm not a researcher, I'm a clinician, but I like to see and show people what the differences are. So the measurements, I think, in the tool are going to be very useful for the patient at home to see, okay, last night it was a heavy meal. All we did is chew, and my jaw is tired. Tomorrow, the next day is sore. Let's see what's going on here. Let's release some tension. Let's begin to optimize function again. Or I've been to the dentist, they did a root canal treatment, my jaw is really tense. And then what can I do intraorally, extraorally right now, before Neil can see me, or before Dad or Stupat can see me, or before, because it might be a Friday night, it might be a Saturday, maybe they don't have any appointments, maybe, and if the protocols are easy enough for the patient and we're not going to cause any harm, then why not? So the protocols have been created in a way where people can just follow that. There is intraoral applications, extraoral applications as well to it. So you can access SEMs, you can access the suboccipitals, you can access the extraoral muscles, you can do lymphatic draining of the face, you can do the intraoral part, you can do palatal stimulation, you can do cranial nerve stimulation with them, you can do quite a bit with it. The tool doesn't look, it looks pretty simple, but the protocols have been placed there thinking about everything that I have learned up to now. And just building up these protocols. And they're from infancy all the way to adulthood, to 80 plus. It's worked really beautifully with the geriatric population. There's so many edentulous people out there that just they're not using the masticatory muscles in the right way. They've lost teeth. They're either using dentures, and the functions are different. And there are stresses, there are stress placed in different muscles that if you give them those protocols, thinking about what exactly is going on in that mouth at that point in time, you'll find that they'll help themselves a lot with that tool.
Okay.
So that's what the thinking is behind it. And that's what the tool is meant to do. I've been asked to put it out there for everybody to use it, and just open it up to the market. But I think what I will probably need to do is when that happens, I will have to do some sort of app or guided course so people can just choose those protocols. But for the time being, once the manufacturing process starts, they will be clinicians or therapists only until we build up to that point where we can open it up completely. But I'm excited. And just like you were saying, you think about one thing and you think, oh my God, we've got so many tools in myofunctional therapy and they're full of plastic. I want to get rid of all that plastic.
Yeah.
So I've got a Myo gym, which I've put together, and it's all made of bamboo.
Wow.
But it will come eventually, and I've got a couple of other tools coming through. Just simple things to minimize and optimize what we're trying to do, and just give the power to the patient to continue with the progress. Yeah,
I love that. And boy, there's so much that I'm excited about seeing, what is coming. And what you're talking about looks and sounds like such a, in this, kind of current era of qualitative assessment, metrics, having trackables, wearables, all these things. These are all good. And I feel like yours has such functionality. So I want to ask you a question, and also just a quick, we got about 5 minutes left on this, but we could hop on right after this too. So
sure.
just know that. So, so that's kind of what I wanted to utilize this opportunity to say. First of all, in the 5 minutes left, I want you to share more on what you want to get out there, but knowing that we're going to see the links and the data, and then your advancing innovation is going to come out, and then people will be able to see what you're doing. But I feel like you said this in here, but I really want to go back to it. Clearly you've been compelled and really driven, and you're so passionate about what you do or what people need that it drove you to spend so much time, energy, and resource into this. So yeah, let's hear, I would love to hear what is this passion that drives you, or what do you see, what is this all kind of, what drives you to create something like this?
I see the need. I really see the need in people. I see perhaps a lot of unnecessary suffering and lack of connection between how our body works and how it's connected to our mind and our, I want to say, our spirit and our emotions. And I feel like we are not really taking into account all of the different layers of those connections. And it saddens me a little bit. So I think the drive is that internal sadness also to see so much need and so much suffering from people. That kind of, I want to make it better for people. I want to help people improve their quality of life. And I feel that I have some of the answers for it. And I feel that the rest of the answers, perhaps, maybe I'm wrong, but I think they maybe lie within the person.
Yeah.
And we have our society and the way we work, our generations have changed things a lot from our ancestors, in the sense that we are constantly shutting down people's feelings, and that the sense of what is going on with me, it is almost like it is wrong for you to voice what is filling what is going on with you. And we do it all the time with children and with adolescents and with moms, especially first-time moms.
Yeah.
You know, they have this gut feeling that something is not quite right, and we're shutting them down.
Yeah.
So, and that saddens me a little bit. And I want to almost say to them, look, I hear you, and you know that child better than anybody else. And if you think there is something wrong, I will try my best to help you find it. Let's explore it. Let's see what happens. These things that you see now with your baby are, a lot of it are compensations. A lot of it. Something is not working quite right from the angle of where they're coming from to us, especially. I'm not saying that, you know, other illnesses and other things will have a different starting point, but from our field and the patients that come to us for orofacial myofunctional therapy, there are lactation issues, there are, you know, posturing issues, there are acid reflux issues. There are so many things that, and no one is looking at what's happened inside the mouth, how that could have started. And if we could look at it, even at those scans, those early scans, when we could see a retronatic mandible, we can maybe see thumb sucking, and, you know, we can see a lot of other things. And we're not going to make diagnosis based on that because it's one scan in one moment in time, but we can begin to just look at things, you know, just piece them together. And maybe that baby, when it's born, we're going to look in that mouth properly because something is, you know. So these things are all my drive. All of these things, I look at them and I think we're missing so much. There is so much. And this is why I take another course and another course. And, you know,